Hello everybody, I hope you all are doing good. In this video we will be talking about the anatomy of knee joint. We will be talking about the bones involved in the formation of knee joint. What are the ligaments present? What are the cartilages present in your knee joint? So let's just begin. So you need to recognize that there are three bones involved in the formation of knee joint. Okay, so this one is your femur that is present superiorly, this one is tibia, and this one is fibula. So tibia is present medially and fibula is present laterally. So this is going to be right knee joint. Okay, then there is another bone present over here, which is patella. Okay, which is actually a sesamoid bone because it's formed in the tendon of quadriceps femoris. So there are total 4 bones present in knee joint. Okay, so after recognizing the medial and lateral aspect of the knee joint, you should know what are the ligaments present because these are very important in preventing certain kinds of injuries. Okay, so before moving forward, I would like you to know that this amazing picture is taken from TeachMe Series, and when I was looking for pictures, I found this one amazing, or you can say best among all, because the color theme they have used to understand the positions of ligament is beyond amazing. Okay, so you should know what are the movements found in this joint. This is classically hinge type synovial joint, and the movements are flexion, extension, internal rotation and external rotation. Different muscles act on these movements, and we are not going to talk about those muscles. We are focusing on the ligaments present. Okay, so I'm going to start by these ligaments, these two shown in yellow and blue. Okay, so you can see that they are crossing each other. They are forming a cross. They are crossing each other in the sense that one is starting on the medial aspect and inserting on the lateral tibia, and the other is starting from the medial on the lateral aspect of your femur and inserting on the medial aspect of your tibia. So they are forming a cross. That's why they are known as cruciate ligaments. Okay, so now which one is posterior cruciate ligament and which one is anterior cruciate ligament? The one which is inserting anteriorly on the tibia is anterior cruciate ligament. This name, anterior or posterior, is with respect to the insertion on tibia. If the ligament is attaching on the anterior aspect of tibia, it's anterior cruciate ligament, and if it's attaching or inserting on the posterior aspect of your tibia, it's posterior cruciate ligament. So the posterior cruciate ligament is shown in yellow. It starts from the medial aspect of your femur and inserts on the posterolateral aspect of your tibia. This is posterior cruciate ligament, and the other one, that's anterior cruciate ligament, it starts from the medial from the lateral aspect of your femur and inserts on the medial aspect of your tibia, but anteriorly. It's anteriorly. Okay, so this is anterior cruciate ligament. So what are the functions of these two ligaments? Posterior cruciate ligament prevents exaggerated posterior movement of your tibia, and the anterior does the opposite. Okay, that is, it prevents the exaggerated anterior dislocation of your tibia during movements. So if someone has the injury of anterior cruciate ligament, their tibia will be dislocated, anteriorly exaggerated. There will be exaggerated movement of tibia anteriorly. Okay, and if posterior cruciate ligament is injured, there will be exaggerated posterior dislocation of the tibia. Posterior movement. Okay, there will be exaggerated posterior movement of the tibia. So you should know. Okay, you should know these. Okay, then we have two collateral ligaments because they are present on the sides of the joint. Okay, now you should know the this is condyle, right? This is femur. Whole of this bone is femur, and this portion of the femur which is taking part in the articulation with tibia is your condyles, and just above the condyles there are bony bumps present which are known as epicondyle. Obviously they will be called as epicondyle because they are present above the condyles. So these epicondyles serve as the attachment site for your collateral ligaments. So the ligament that is present medially is known as medial collateral ligament, and that is present on the lateral side is lateral collateral ligaments. So what are the functions of these ligaments? they prevent varus and valgus deformity. Now you should know what are varus and valgus deformities. Just go on Google and search for different pictures, and pause the video here, come back and see the other part of the video which I'm going to tell you now. Okay, so varus deformity is when you have like this is varus. Okay, if someone has bowed legs, it means that the joints are moved away from each other. Suppose this is the knee joint and this is the other knee joint, so the joints are moved away from each other, right? The joints have moved away from each other, and in this classically in this varus deformity you have the injury of lateral collateral ligament, because the lateral collateral ligament prevents the exaggerated lateral movement of your joint. So if someone has these kind of legs, they have varus deformity, and there is classically the injury of your lateral collateral ligament. Okay, now what is valgus deformity? If someone has like this, if the legs are like this, it means that there is the deformity of medial collateral ligaments. That's why the joints have moved towards each other. Okay, they have moved towards each other. Okay, and there is classically the injury of your medial collateral ligament. Okay, so they basically prevent the medial collateral ligament prevents the exaggerated movement of joint medially, and the lateral collateral ligament prevents the movement of joint, the exaggerated movement of joint towards the lateral aspect of your joint. Okay, and then there are two menisci that you should know. These are covering the articular surfaces. They are the medial meniscus and then lateral meniscus. Okay, and these menisci provide the lubrication during joint movement, and yeah, you should know these things. This is very important for me. I hope this is clear. If you have any kind of questions, write them down in comment section, and best of luck.